Hello friends, today we will discuss another important topic, obesity. Overview. Preparation time will be given 3 minutes. Try to utilize the whole 3 minutes, reading the scenario well and prepare your strategy. Examination and discussion 8 minutes allotted. Warning bell will be given at 6 minutes. Marks allotted 8. What is the definition of obesity? Children with BMI above 98 centile will be considered as obese clinically. What are the causes? It could be familial or genetic, nutritional or unhealthy diet, endocrine, hypothyroidism, Cushing syndrome, polycystic ovarian syndrome, syndromes, congenital syndromes like Prader-Willi syndrome, Laurent-Moon-Bardet-Biedl syndrome, Down syndrome, Klinefelter syndrome, Beckwith-Whitman syndrome. Or it could be because of side effects of some drugs like steroids. Introduction. Always greet the patient. Introduce yourself, define your role and responsibility. Wash your hand with sanitizer and take the COVID precautions. Ask for consent for examination and exposure. Make rapport by asking short question, what is your name, what is your favorite food, who is your favorite poster. Look for any dysmorphism, any distress, any disease stigmata. Measure height, weight, head circumference and BMI, which is extremely important in this scenario. Look for the surrounding for any drugs like any steroid or any medication used for obesity like orlistat, metformin, and check for any device. Then start head to toe examination. Start with head. Look at the face, whether it is chubby or not, any moon face is present or not, any acne present or not. Then check neck. Look for thyroid swelling or any acanthosis. Check the hand and examine it very well. Small hands are noted in Prader-Willi syndrome. There could be extra finger or scar marks. It could be associated with Beckwith-Whitman syndrome. Check the pulse and blood pressure. Then examination of respiratory system. Because look for any sleep apnea, because it is very commonly associated with obesity, and check whether any gynecomastia present or not. Then do the proper CVS system examination. Check the abdomen, look for hepatosplenomegaly or any scar present in right hypochondrium. It could be because of gallbladder dysfunction. For that reason, the gallbladder is removed. Comment on genitalia. Do proper pubertal assessment. Hip examination is extremely important because slipped capital femoral epiphysis could be associated with obesity as complication. Check the lower limb. What is the metabolic syndrome? Which is comprised of obesity, hypertension, diabetes, dyslipidemia. That means low HDL, high LDL. What are the complications of obesity? Sleep apnea, commonly associated, slipped capital femoral epiphysis. If a obese teenager presented with hip pain, always think about it. There could be cardiac problem, most commonly hypertension or ischemic heart disease in later. Liver dysfunction could be associated like fatty liver. There could be gallbladder dysfunction. So gallstone could be the complications. Look for any joint pain. Skin fold rash like any stretch marks could be present. Infertility chronic kidney disease because of long-standing hypertension. There is a high chance of getting cancers and depression. Important points: always ask for consent before exposure. Try to be methodical. Head to toe examination is the key. Don't forget to measure BMI and make comment on genitalia. Summarize your positive finding. Most common cases given in examination: Prader-Willi syndrome, Cushing syndrome, metabolic syndrome. Investigations: don't forget to mention fasting blood sugar, lipid profile and liver function test, insulin level and thyroid function test. Management could be non-pharmacology like maintenance of good diet, healthy habits, exercise, and pharmacology could be Orlistat. In US, metformin is used. And in morbid obesity, surgical like bariatric surgery. Obesity is important for history station, communication, video station, and clinical station.